for 5 minutes.
Thank you, Mr. Chairman. I just want to take a few minutes, since the chairman has walked through the greatest hits of the problems they've had with the ACA, of where we stand now and where we stand after the first enrollment period has just closed. So as we continue to get information about how the exchanges in the Affordable Care Act and the enrollment are performing, let's review what we already know. The first thing is, despite the disastrous beginning of the federal exchange, good news, the website was fixed. More than 8 million people signed up for insurance through the exchanges created through the Affordable Care Act, which is more than 1 million more than were originally projected before the disastrous unveiling. Now, of those 8 million people that waited till the last month of enrollment, of those 8 million people, 3 million of them waited till the last month of enrollment. And so their premiums are not due until April 30th, or in some cases, later than April 30th. Even so, my colleagues, in their quest for knowledge on the other side of the aisle, sent out a questionnaire to insurers that manipulated the payment deadlines to skew the understanding of how new insurance coverage is performing. How does that happen? Because they cut off the responses April 15th, at least 2 weeks before many of the premiums of these 3 million people were even due for payment. What this does is it skews the amount of people who are enrolled. Then, of course, they issued a press release post-haste. Now, for years, my friends on the other side of the aisle have made a series of claims that really are unsubstantiated. First, they claimed that the bill contained death panels. Then they claimed that the bill would eliminate private insurance within 3 years. Then they claimed that the law would destroy millions of jobs. When the website was broken, they insisted the law would never meet enrollment goals. Now, Mr. Chairman, today we finally have a chance to see in a snapshot what's happening with the Affordable Care Act. And the facts reveal that every single one of those claims were wrong. As of today, as I said, more than 8 million people enrolled in private plans through federal and state marketplaces. Millions more have enrolled through Medicaid and in off-exchange plans. Gallup just released a new poll finding that in the last 6 months, the percentage of adults without insurance has dropped about 20%. And what that means is there are more than 11 million Americans with insurance today than there were 6 months ago. Premiums are below the levels predicted by the Congressional Budget Office, and the agency has once again reiterated that the Affordable Care Act has slowed inflation and saved billions of dollars and will even reduce deficits. So by any rational, reasonable measure, we can call this law a success. And that success will make a real difference in people's lives. That's what's important here. Yesterday, researchers from the Harvard School of Public Health released a comprehensive study on the impacts of health insurance coverage. They were looking at mortality rates before and after the passage of Romneycare, the landmark Massachusetts health insurance expansion that served as a model for the Affordable Care Act. They found that the mortality rate in Massachusetts fell by about 3% in the 4 years after passage of the state's health insurance law. Mr. Chairman, I would like to ask unanimous consent to put a copy of that study into the record.
Without objection.
Thank you. So if we can achieve that same level of success nationwide with the Affordable Care Act, and there's no reason why we shouldn't be able to do so, that could result in 17,000 fewer deaths per year. That, Mr. Chairman, in a nutshell, is what the Affordable Care Act means for Americans. Now, what I wish we could do in this subcommittee, and I've said this both publicly and privately many, many times, is sit down with the ACA, figure out what the flaws are, and figure out how we can work in a bipartisan way to fix it. And that's what I think we should do. Instead, what we get is this misleading analysis last week, which said that only 67% of enrollees had paid for the coverage they enrolled in on the exchanges. And my chairman, Mr. Upton, said the administration's recent declarations of success may be unfounded. But again, I will say the report was misleading because almost half of the enrollees in the healthcare exchanges, 40% of them, did not even have to make their initial premium payment until April 31st. I'm glad we've got the insurers here today to clear up this record. I'm glad we have everybody here to see exactly what we're talking about here. So my suggestion is, let's look at the successes, let's look where we need to make improvements, and let's work together to do just that. Thank you.
Gentleman's time expired. Now recommend the chairman of the full committee, Mr. Upton, for 5